Last time on What the Hell, we pulled back the curtain on the devastating impact of abortion bans. We talked about the women forced to carry non-viable pregnancies, the doctors too afraid to provide care, and the patients left bleeding in emergency rooms, waiting until they were sick enough to be helped. And we made one thing crystal clear. Abortion bans don't stop abortions. They just stop safe ones. But this fight isn't just happening inside hospital walls, because while patients suffer, lawmakers, judges, and politicians are making decisions that could erase abortion access completely, even in states where it is still legal. At the center of the next battle, one little pill, Mifpristone, the drug that revolutionized abortion care, the pill that made it safer, more private, and more accessible than ever. And that pill, if anti-abortion groups get their way, could be banned nationwide. But that's just the beginning. Because today, we're breaking down the war on medication abortion, the Texas lawsuit where women are suing their own state for denying them life-saving care, and the battle in Congress over whether abortion will be protected or banned at the federal level. And then we're going even deeper into the human cost. What happens when abortion bans force desperate people to take matters into their own hands? Are we already seeing the return of back-alley abortions? And what does this all mean for the future of reproductive rights in America? This isn't just legislation. It's about control, about power, about deciding who gets to make choices and who is stripped of them. And if you think this won't affect you, think again. This is part 2 of our abortion deep dive. Welcome to What the Hell? Let's get into it. If you've been following the abortion debate, you've probably heard the name Mifpristone thrown around. But what is it really? And why is it at the center of one of the most significant Supreme Court cases in recent history? So Mifpristone isn't some experimental, untested drug. It's been used for over 20 years, backed by decades of research, and proven to be safer than many medications you can buy over the counter. Yet anti-abortion groups are trying to convince the courts that it's dangerous, that the FDA rushed its approval, and that it should be pulled from the market nationwide. So let's get into it. What is Mifpristone? How does it work? And why is it so controversial? So let's talk about the science behind Mifpristone first. So Mifpristone, also known as RU486, is the first drug used in medication abortion regimens. It works by blocking the hormone progesterone, which is essential for maintaining a pregnancy. Here's how it works. Pregnancy depends on progesterone. This hormone helps maintain the uterine lining, keeping it thick and full of nutrients to support the developing embryo. But Mifpristone blocks progesterone receptors. Once progesterone is blocked, the uterine lining begins to break down, cutting off the embryo's supply of oxygen and nutrients. And without progesterone, the pregnancy can't continue. The cervix softens, the uterine lining sheds, and the pregnancy detaches. After approximately 24 to 48 hours, you take a second medication called Mifpristone. This second medication causes the uterus to contract, expelling the pregnancy, similar to an early miscarriage. Mifpristone itself doesn't force the abortion. It simply removes the body's ability to sustain pregnancy. This process is very similar to what occurs naturally in a miscarriage. So Mifpristone isn't some new or experimental drug. It has been extensively studied and used safely in the U.S. since 2000. But its history goes back even further. And just so you guys have an understanding of this history, I want to give you a little background. Mifpristone was first developed in 1980 by French researchers at, and I'm going to butcher this, I apologize, Roussel-Youclaf, a pharmaceutical company. An early study showed that blocking progesterone could safely and effectively end early pregnancies. In 1998, France became the first country to approve Mifpristone for abortion under the name RU486. It quickly spread across Europe, with UK, Sweden, and China approving it in the early 90s. In 1993, U.S. researchers began testing Mifpristone in their own clinical trials. By 1999, studies involving thousands of patients confirmed its safety and effectiveness. And in 2000, the FDA approved Mifpristone for use in medical abortions. So what were the key findings from the clinical trials that the U.S. did? Well, effectiveness. They found that 95 to 99% effective at terminating pregnancies up to 10 weeks. That means in 95 to 99% of patients that were pregnant before 10 weeks, so 10 weeks and before, Mifpristone was effective at terminating those pregnancies. Also, another thing they found was the safety of Mifpristone. Less than 0.4% of patients experience serious complications. That means it's safer than Viagra, Tylenol, even penicillin. Additionally, they found no impact on future fertilities, meaning that patients can get pregnant as soon as they're ready to again. For context, Mifpristone is safer than aspirin. Yet, the same people trying to ban it aren't fighting to restrict access to painkillers, even though those kill thousands of people a year. So now that we understand what Mifpristone is and how it works, let's talk about the lawsuit that's trying to take it off the market. Enter Alliance for Hippocratic Medicine v. the FDA. So the Alliance for Hippocratic Medicine, that we will call the AHM, is a coalition of anti-abortion doctors and activists. They are suing the FDA to revoke Mifpristone's approval, claiming it was rushed and that the drug is unsafe. In a very strategic move, the case was filed in Amarillo, Texas, where Judge Matthew Kaczmarek, a Trump-appointed conservative, is guaranteed to hear it. Which seems a little convenient, doesn't it? Anyway, the AHM claims that the FDA didn't follow. Let me start that one again. So what are the arguments made by the AHM? Well, they're claiming that the FDA didn't follow proper approval procedures. False. Mifpristone underwent rigorous testing, 2 decades of research, and multiple safety reviews. Mifpristone is dangerous and causes life-threatening complications, another allegation by the AHM. To that I say, false. Mifpristone has a lower complication rate than Tylenol, antibiotics, and even childbirth itself. The risk of serious complications is 0.4%, meaning it's safer than colonoscopies and wisdom teeth removal. One of the final allegations being made is that doctors are being forced to provide abortions against their beliefs. False. No doctor is required to prescribe Mifpristone. The lawsuit isn't about individual choice. It's about removing a safe and effective medication from everyone, regardless of their beliefs. But how is the FDA responding? Well, the FDA has aggressively defended its approval of Mifpristone, making it clear that Mifpristone is one of the most heavily studied drugs on the market today. Over 5 million Americans have safely used it since it was approved in the year 2000. And there is zero scientific evidence to justify banning it. The Biden administration warned that if Supreme Courts side with the AHM, it could undermine the entire FDA approval process, meaning any controversial drug from birth control to vaccines could potentially be at risk. I mean, think about that. If the AHM wins and they say that the FDA didn't undergo the proper process, all medications that have been approved recently could be reevaluated. That's kind of scary. So what's going to happen if Mifpristone is banned? Well, abortion will be effectively banned in all states that rely on medical abortions. Patients in blue states will have fewer options, overwhelming surgical abortion providers. And doctors could be criminalized for prescribing Mifpristone, even in states where abortion is legal. This isn't just about one drug. It's about control. It's about using the courts to strip away rights that have already been fought for and won. But while the courts battle over abortion pills, patients are living this reality every single day. And for some, these restrictions are more than just frustrating. They're deadly. Next, we're talking about the real people caught in the crossfire, the patients who have been denied life-saving care, the doctors afraid to do their jobs, and the human cost of abortion bans in America. Because this isn't just policy. This is life or death. The next thing I want to mention today is a lawsuit in Texas where women are fighting back against their own state. While conservative lawmakers are pushing for more restrictions, a group of women in Texas is taking their state to court because they were denied life-saving care. First one I want to mention is Zurawski versus State of Texas. That's Zurawski. So Amanda Zurawski was 18 weeks pregnant when her water broke too early. In medical terms, this is called preterm premature rupture of membranes, or PPROM, and it's extremely dangerous. Without the amniotic sac, the fetus can't survive, and the pregnancy person is at a high risk of infection, sepsis, and death. So doctors knew Amanda's baby wouldn't survive, and the safest option was to terminate their pregnancy immediately. But because of Texas' abortion ban, they couldn't legally act. The law said that they had to wait until Amanda was, quote, actively dying before they could intervene. Actively dying. So they waited. And Amanda developed a massive infection. Her fever spiked, her blood pressure plummeted, and by the time doctors were allowed to treat her, she was in full-blown septic shock. Now, Amanda survived, but she lost her fertility. She will never be able to have children now. And Amanda isn't alone. Lauren Miller is another plaintiff in the case. She was carrying twins when one was diagnosed with trisomy 18, a fatal condition. She was denied care and forced to carry the pregnancy for weeks, which endangered her surviving twin. Ashley Brandt, another woman suing Texas, had to fly out of state for an abortion for a pregnancy that was non-viable. The Texas Supreme Court is set to hear this case, and its ruling could change how medical exceptions to abortion bans are interpreted nationwide. And while the courts are deciding on abortion access state by state, Congress is fighting over whether abortion should be banned or protected at the federal level. The Women's Health Protection Act, restoring Roe v. Wade. This bill, if passed, would restore the protections of Roe v. Wade, ensuring abortion remains legal nationwide. It has been introduced multiple times, but has been blocked in the Senate. If Democrats regain control of Congress, this will likely be their first priority in reproductive rights. The National Abortion Ban Proposal. Some lawmakers are pushing for a 15-week national abortion ban, meaning abortion would be illegal in all states after that 15-week point, even in places like New York and California where abortion remains legal. And other lawmakers are pushing for a full nationwide ban with zero exception. So why does this matter? If a national abortion ban is passed, it will override state laws. That means even if your state has legal abortion protections, it doesn't matter. Federal law will take precedence. This is the long-term goal of anti-abortion lawmakers. And if the right political conditions align, it could happen. So let's recap. We have a Supreme Court case that could ban abortion pills nationwide, a state-level lawsuit that could redefine medical exceptions, and a Congress that is actively fighting over whether abortion should be permanently banned or protected. This isn't just a state issue. This is a national crisis. But what does all of this actually mean for patients? How does it impact real people trying to make real decisions about their health? Next, we're diving into the human cost of abortion. The women whose lives are being destroyed, the doctors forced to choose between their patients and the law, and the devastating consequences unfolding right now. Let's talk about what happens when ideology replaces medicine. At this point, we've broken down the laws. We've talked about the Supreme Court cases, the bills in Congress, and the battle over Mifpristone. But what happens when these legal decisions stop being theoretical? What happens when they reach actual patients, actual families, actual doctors who have to decide, do I follow the law or do I save a life? Because while politicians and judges argue over legal language, real people are suffering. They're not just debating rights in a courtroom. They are bleeding out in emergency rooms, waiting until they are sick enough to help. They're forced to carry pregnancies that will never survive. They are being told that their pain doesn't matter. Their trauma doesn't matter. Why? Because the law says so. So let's talk about them. Let's talk about the people the system is failing every single day. So one of the biggest myths about abortion bans is that they protect the mother's life, that if a woman is truly in danger, she'll get care. But the truth, the law is so vague that doctors are afraid to act, so they wait. They wait until a woman is bleeding out, septic, her organs shutting down, because if they intervene too soon, they could face felony charges. You remember Amanda Zerwowski that we talked about earlier? 18 weeks pregnant, her water broke too soon, her doctors knew immediately that her pregnancy wasn't viable, and the safest option was to terminate. So, because she lived in Texas, doctors couldn't act until she was actively dying, and that is a direct quote. So they sent Amanda home. They told her to come back if she developed an infection. In other words, they just had to wait until she was more sick. And Amanda did. She went home. A few days later, she was rushed back to the hospital with a raging infection. Her fever was spiking and her blood pressure plummeted. She was in full-blown septic shock. Doctors were able to treat her just in time to save her life, but it was too late to save her fertility. Because she was forced to wait, Amanda developed so much scar tissue that she will never be able to have children. And let's be very, very clear. This was preventable. Amanda had a medical emergency and she was denied care. Not because doctors didn't know what to do, but because the law forced them to stand by and watch her suffer. Another myth about abortion bans is that they stop abortions from happening. I'll tell you right now, they don't. They only stop safe abortions from happening. And let me be crystal clear. When people are desperate, they will do whatever it takes to end a pregnancy. This isn't speculation. This is history. And it is happening again right now in America. We're already seeing it. The rise of unsafe, self-managed abortions. The quiet return of what we once called back alley abortions. The spike in maternal deaths, not because abortion is legal, but because it is illegal. Listen to this. In states with abortion bans, Google searches for how to do an abortion at home have increased by over 160%. And calls to abortion hotlines have surged, with more people asking about unregulated pills, herbal methods, and physical self-harm. The CDC is already warning of an impending increase in maternal mortality due to unsafe abortion attempts. And we've been here before. Before Roe v. Wade, when abortion was illegal across much of the country, tens of thousands of women took matters into their own hands, and many of them didn't survive. Before Roe v. Wade legalized abortion in 1973, the U.S. saw thousands of women die every year from botched, unsafe abortions. So the numbers before Roe v. Wade. In the 1950s and 60s, an estimated 200,000 to 1.2 million, which is a big gap, illegal abortions were performed annually in the U.S. Up to 1.2 million illegal abortions were performed in the U.S. Septic wards in hospitals were full of women dying from infections after unsafe abortion attempts. And in 1965, illegal abortion accounted for 17% of all maternal deaths. Hospitals used to have entire septic abortion wards filled with patients suffering from infections, hemorrhages, and injuries from botched procedures. Doctors saw it constantly. Women arriving with perforated uteruses, deadly infections, internal bleeding. They saw teenage girls, desperate mothers, rape victims, all victims of a system that abandoned them. And now, we're seeing those same patterns again. In 2023, a 22-year-old woman in Texas found out that she was pregnant. She was already struggling, barely making rent, no support system, no options. And in Texas, abortion was completely banned. So she turned to the internet, searching for home remedies. She read about a certain herbal tea that could induce miscarriage. So she went and bought the ingredients, brewed it, swallowed it down, not realizing that in high doses, the compounds in this tea are incredibly toxic to the liver. By the time she got to the ED, she was in liver failure. Now, she survived, but barely, and she's going to need a transplant within the next few years. This is not an isolated case. ER doctors are already reporting an increase in patients attempting self-managed abortion with toxic herbs, foreign objects, and even physical trauma. In some states, people are resorting to unregulated abortion pills sold online, sometimes counterfeit, sometimes ineffective, sometimes deadly. Clinics in neighboring states are seeing patients arrive with serious complications, sometimes too late to save them. This is what happens when you take away options. People don't stop needing abortions. They just stop surviving them. And let's talk about what happens when people can't access safe abortion care. Because banning abortion doesn't just increase unsafe abortions. It increases deaths from pregnancy itself. The research is clear. A 22 study published in JAMA found that pregnancy-related deaths could increase by 33% in abortion-banned states. The United States already has the highest maternal mortality rate of any developed country. And in Texas, pregnancy-related deaths nearly doubled after strict abortion bans were introduced. Pregnancy is far riskier than abortion. The risk of death from childbirth is 14 times higher than the risk from illegal abortion. Conditions like preeclampsia, ectopic pregnancies, and hemorrhaging are deadly when left untreated. More states are denying care for pregnancy complications because doctors fear legal consequences. In 2024, a woman in Tennessee, let's call her Rachel, was 19 weeks pregnant when she was diagnosed with a ruptured placenta. The doctors knew her baby wouldn't survive. They also knew that Rachel was at risk for a massive internal bleed. The safest medical decision was to terminate the pregnancy before her body went into crisis. But the law wouldn't allow it. Tennessee bans abortion unless a patient is actively dying. There's that word again, actively dying. So of course, they waited. Rachel started hemorrhaging at home. By the time she reached the hospital, she had lost too much blood. The doctors worked desperately to save her, but it was too late and Rachel died in the ICU. She did not have to die. If doctors had been legally allowed to provide an abortion when it was medically necessary, Rachel would still be alive. And this isn't just Tennessee. Hospitals in abortion-banned states are seeing these same trends. More women suffering, more complications, more deaths. This isn't just about politics. This is about survival. More people are attempting unsafe abortions. More hospitals are turning away patients. More people are dying, not because of abortion,